Wow.
Okay, ready.
Staring blankly. Hemoglobin A1c.
Got it.
What? Oh. We're talking about hemoglobin A1c, a great indicator of overall what your blood sugar levels are, and it averages out basically what your blood sugar is over the course of the previous about 3 months or so. It gives you a much better idea of where your blood sugar is at rather than just one-time finger stick blood glucose or glucose you get just on your metabolic panel, because those are just a snapshot in time, like lab work is. It's just what your blood glucose was at that second that you got that finger stick or the blood draw. A lot of things can affect it. An A1c is more of an average. So what's normal? Ideally, we want that number less than 5.6. So like 5.8 to 6.4 is kind of pre-diabetes range. So if your A1c is in that level, you can definitely do some lifestyle changes. What I would recommend is increasing your cardio, watching your diet, maybe losing a little bit of weight if you have some weight to lose, and that should bring that number down.
So is this repairable or is
it kind of depends on what the cause of your diabetes is. So obviously type 1 diabetics are born with it, usually. So those people are usually needing to be on lifelong insulin therapy.
Okay.
So type 2 diabetes, it's usually later onset, often caused by obesity, metabolic syndrome. So those type 2 diabetics, absolutely, especially if you catch it early on, can certainly be reversible. I've seen plenty of people in the pre-diabetic range or even diabetic range, and with lifestyle changes, they've brought that A1c down and they're no longer diabetic, they're no longer on medications. It absolutely can be done.
Where can I figure out what my A1c score is?
Just get your labs drawn. If you have a primary care doctor or doctor you follow with outpatient, they should be ordering this, I would say, on a yearly basis. For someone who's generally healthy, doesn't have diabetes or any of that history, once a year is perfectly fine. Goal for my competitive athletes, ideally I like that number to be less than 5.5. So the lower that number is, that tells me that your body is more insulin sensitive. And that's actually a good thing. So sometimes when people hear insulin sensitivity, they think it's a bad thing, but insulin sensitivity is a good thing. It means your body is sensitive to the insulin that it produces. Because a lot of people who are diabetic, their body becomes so engorged and overproduces insulin to the point where they become almost resistant to it, and their body doesn't respond as well to it. So
there's a difference between insulin sensitivity and insulin resistance.
Yes. Yes. Insulin sensitivity is actually a good thing. Insulin resistance, we don't want that, because obviously we need insulin to utilize the nutrients that we're eating and fuel our muscles and do a lot of other bodily processes.
All right, thanks guys for watching. Please subscribe, like, and anything you guys want to see us to touch on, please ask, DM us. We love the stuff. We appreciate you guys.